Jenkins, you're now recognized.
Well, I want to thank the chairman again for holding this hearing and for all of you for testifying today. We've got great bipartisan support in the House and even on this Ways and Means Committee to repeal this provision. And I hope that hearing some of the facts today will encourage even more of our colleagues to support removing this burden on consumers. Mr. Chairman, I would ask unanimous consent to enter a letter of support into the record. It is from the Health Choices Coalition, and it's simply supporting the repeal of this prescription requirement from the health care law.
Without objection.
One of my constituents back home, Donna, in Fort Scott, Kansas, wrote me at the beginning of this Congress, and this is what she said. My husband and I try to stay very healthy and really enjoyed the flexibility of the health savings accounts as it once was. It was very convenient to be able to buy over-the-counter products to manage our own health care. Americans should choose a healthier lifestyle which could cut down on costs tremendously. I do not know why anybody wants the government to be so involved in the management of the money we have worked so hard to earn. Please work hard to get this part of the Health Care Act repealed. And I struggled to provide a rational response to this constituent as to why this prescription requirement was even included in the President's health care law in the first place. It doesn't provide better health care for consumers, and I can't figure out how it would lead to creating the 4 million jobs that then Speaker Pelosi promised the bill would create. To me, the only logical response was that it was a simple line item that provided revenue to help pay for the massive overhaul, which is why we've introduced legislation to repeal this provision. Ms. Hatcher, you mentioned in your testimony all the work your organization did to comply with the original 2008 IRS guidelines. Then we passed the health care law, and you all get new guidance just weeks before you must comply with these new prescription requirements. You mentioned companies spent about $100,000 to comply with this new provision from the health care law. Do you know what the average salary is for a full-time employee in your member companies?
It would depend upon the position. So there would be a wide variation between the various positions in the store, but it would be well below that expenditure.
So you think you could hire at least a couple full-time employees for the cost of just getting the system set up?
Certainly.
What concerns me most about this investment you all had to make was that it may have come at the expense of your members creating new jobs at a time when that's what we need the most. Could you estimate for me or have you received any anecdotal feedback on how this new requirement is hindering job growth for your members?
Well, certainly, as you mentioned, the expenditures that were put into the system, and there are ongoing expenditures that I didn't really factor in. Just to add to Congresswoman Black's list, one additional expenditure is the most expensive position and the hardest to fill in the supermarket environment is the pharmacist position. And now we have to have a pharmacist involved in the sale of every OTC product that has a prescription, and it's taken them away from really counseling sick patients. So certainly I would add that to the list of those expenses.
Okay, thank you. Mr. Melville, you mentioned a study in your testimony, specifically the fact that every dollar spent by consumers on OTC meds saves $6 to $7 for the U.S. healthcare system as a whole. Can you elaborate a little more on some of the findings of that study?
Sure, thank you. The study looked at a hypothetical world that said if OTC medicines were not available, what would consumers do? And so they polled 3,500 consumers and got a direction from them that many of them would go to see a doctor, many of them would go to an emergency room, many of them would seek a more expensive prescription medicine, all behaviors that add costs to the healthcare system, not reduce costs. And by looking at that and extrapolating, it came up to about $102 billion in current value today because of OTCs. OTCs keep consumers or patients out of a medical office when they don't need to be there. It allows them to purchase a product on their own without the involvement of a pharmacist per se, no dispensing fee. It's cost-effective health care. It's not appropriate in every situation, absolutely not. But where it is appropriate, it's cost-effective and it should be encouraged. And this study shows the benefits of OTC medicines. It makes it difficult to understand how this provision could be scored at saving money for the healthcare system when it's causing people to go see doctors.
Thank you, Mr. Chairman.